Medication errors can cause severe physical injury and possible death to patients. These preventable mistakes could also cause severe financial, psychological, and emotional stress to the healthcare provider and organization. Serious harmful results of a medication error may include death, life-threatening situations, hospitalization, disability, and birth defects. Medication errors can occur throughout the medication use system, such as when prescribing a drug upon entering information into a computer system, when the drug is being prepared or dispensed, or when the drug is given to or taken by a patient. According to the World Health Organization, the total cost as a result of medication errors exceeds $40 billion annually. According to the Institute of Medicine, medication errors cause 1 out of 131 outpatient and 1 out of 854 inpatient deaths. In this video, we will explore the different types of medication errors, their impact on the healthcare system, and how we can prevent them to have a positive impact. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine-related videos. According to the National Coordinating Council for Medication Error Reporting and Prevention, a medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. So as you can see, it could occur at any step of the medication prescribing, dispensing, using process. Now let's discuss some numbers. The US FDA receives more than 100,000 reports each year associated with a suspected medication error. FDA reviews the reports and classifies them to determine the cause and type of error. The reports come from drug manufacturers and healthcare professionals and also consumers through the MedWatch program, which is the agency's safety information and adverse event reporting program. Serious harmful results of a medication error may include death, entering a life-threatening situation, hospitalizations, disability, and birth defect. Each year in the United States alone, 7,000 to 9,000 people die as a result of a medication error. Additionally, hundreds of thousands of patients experience but often do not report an adverse reaction or other medication complications. The total cost of looking after patients with medication associated errors exceeds $40 billion globally each year. In addition to the monetary costs, the patients experience psychological and physical pain and suffering as a result of medication errors. Finally, a major consequence of medication errors is that it leads to decreased patient satisfaction and a growing lack of trust in the healthcare system. Medication errors are extremely costly. Think about the unnecessary hospitalizations, other time, procedures, and medications required to treat complications from medication errors, legal costs, malpractice, insurance issues, and so on. As mentioned before, per the World Health Organization, the global cost of medication errors is estimated to exceed $40 billion. Also, the World Health Organization 2017 stated that in the USA, medication errors caused the death of about 7,000 patients and about 400,000 cases of unavoidable patient harm per year, which costs $3.5 billion. According to a study in 2010, $19.5 billion spent on total medical mortality and short-term disability costs, 10 million on average cost of missed days of work, and 13,000 average cost per medical error. These numbers are much higher now since we are in 2023. More importantly, there are serious medical impacts. For example, taken from the United Kingdom's NHS site. Examples of real-life issues: fatality due to bleed following organ biopsy as heparin mistakenly administered after biopsy. Failure to calculate and administer the correct dosage of morphine resulting in ongoing impairment of function. Fatality due to failure to administer anticoagulant in a timely manner, subsequently leading to death as a result of pulmonary embolism. Inadequate anesthesia for cesarean section leading to pain and post-traumatic stress syndrome. So again, these are just a couple examples of serious medical impacts which can occur as a result of any medication error. Medication errors are most common at the ordering or prescribing stage. However, they can occur at any stage or step throughout the process. Typical errors include the healthcare provider writing the wrong medication, the wrong route or dose, or the wrong frequency. These ordering errors account for almost 50% of medication errors. Data show that nurses and pharmacists identify anywhere from 30 to 70% of medication or ordering errors. It is obvious that medication errors are a pervasive problem, but the problem is preventable in most cases. At a high level, the most common system failures include inaccurate order transcription, drug knowledge dissemination, failing to obtain allergy history, incomplete order checking, mistakes the tracking of the medication orders, poor professional communication, and unavailability or inaccurate patient information. Some specific types of medication errors include prescribing errors, omission of information, wrong time, duration entered, prescribing an unauthorized drug, improper dose entered, wrong dose prescription or wrong dose preparation. Administration errors include the incorrect route of administration, giving the drug to the wrong patient, extra dose or wrong rate. Monitoring errors such as failing to take into account patient liver or renal function, failing to document allergy or potential for drug interaction, compliance errors such as not following protocol or rules established for dispensing and prescribing medications. Now let's list some of the risk factors that may cause or lead to medication errors. One common problem is high volume. The healthcare system is overwhelmed with the amount of support that it needs to provide the patient population. This is something that the system needs to look into and try to solve as a long-term solution. Other risk factors include poor handwriting, inexperienced staff, challenging patient populations, lack of follow-up, appropriate monitoring, lack of policy enforcement, medically complex patients, medications requiring calculations, environmental factors, poor communication, shift work or shift changes in terms of transferring information, workplace culture, verbal orders rather than having proper written orders in place, and interpersonal factors such as external stress. Now, the risk factors we just discussed may lead to the following causes of medication errors: expired product being prescribed, incorrect duration, preparation, strength, rate, timing, dose form, incorrect patient action, prescribing a known allergen to a patient, prescribing a product where the product is contraindicated to that patient, errors by the pharmacist in terms of prescribing, distractions by any member of the healthcare system, such as the doctor being distracted, nurse, pharmacist, assistants, even the consumer being distracted and perhaps picking up the wrong bottle. Illegible writing is a very big issue. Duration of treatment, taking something longer than prescribed, and use of abbreviations, where abbreviations may be misunderstood. A period may be considered an I, for instance, or even different countries having different abbreviations. This is something that should be discouraged. What you see here is the strategic framework of the Global Patient Safety Challenge, which was implemented by the World Health Organization. It depicts the four domains of the challenge: patients and the public, healthcare professionals, medicines, and systems and practices of medication. The framework describes each domain through four subdomains. The three action areas, namely polypharmacy, high-risk situations, and transitions of care, are relevant in each domain and thus form an inner circle. So this is something that everyone should really look at, especially those members of the healthcare uh, system, looking at the different domains, subdomains, and key action areas. So do look at this, study it in detail, so you can have a better understanding of this framework and how you can implement it to improve patient outcome. Another chart or graph worth mentioning is this index for categorizing medication errors as determined by the National Coordinating Council that we had talked about earlier. This color-coded pie chart ranges from category A, which is circumstances or events that have the capacity to cause error, all the way to category I, which is an error that occurred that may have contributed or resulted in the patient's death. So there are definitions here on the right side: harm, monitoring, intervention necessary to sustain life, which will help you understand what the different categories are. And they are color coded, uh, starting from capacity to cause an error, to error, no harm, error, harm, and error, death, which is category I. So this is something that was, again, implemented by the NCC to help categorize errors, to help the healthcare system try to look at where errors may be occurring and try to minimize them and decrease negative outcomes. Now let's talk about actions you can take to prevent medication errors from occurring. First, let's take some advice from the UK NHS. Uh, some bullet points here that they mention. Firstly, ensure a designated person monitors your local health agency's site about medication safety updates and cascades that information through your organization. So in the UK, the local health agency is the MHRA. In the US, this would be the US FDA. Secondly, organizations should report all medication incidents, take action to improve medication safety locally, and work with local safety champions. Ensure robust policies and procedures exist for medications. Cascade local medication administration policies, regulations, and guidelines. Implement medication reviews and have local safety champions. Ensure prescribing audits are routinely carried out. Regular review of the organization's medication error claims. Ongoing education to ensure frontline staff are aware of medication errors. Consider collaborating with the Medication Safety Improvement Program at the NHS through this website listed. So the main points that are being recommended here is self-monitoring, have local safety champions that can help and guide the members of your organization through any medication error issue, and to also help prevent them from occurring. Now let's talk about some actions that were taken by the US FDA and further advice that they have. So first, talking about uh, proprietary brand names and possible confusion among different drug names. With the help of stimulated prescriptions and computerized models, FDA determines the acceptability of proposed proprietary names to minimize medication errors associated with product name confusion. Secondly, container labels to help healthcare providers and consumers select the right drug product. If a drug is made in multiple strengths, for example, 5 milligram, 10 milligram, 25 milligram, the labels of those three containers should be easy to differentiate. The label design may use different colors or identify the strength in large, bold numbers or letters. So the the bottles that are distributed by the manufacturers should use these methods, such as different color codings, to help differentiate design. Uh, Thirdly, prescribing and patient information to ensure the directions for prescribing, preparing, and use are clear and easy to read. Tablets and other oral dosage forms should have distinct and legible imprint codes so healthcare providers and consumers can verify the drug product and strength. Oral syringes and other dosing devices co-packaged with a liquid oral dosage form should be appropriate for the doses to be measured. Dosing errors have been reported when an oral syringe is labeled with milligrams, but the dose is prescribed in milliliters. Lastly, the package design should protect the consumer against incorrect use. Medications applied to the skin should not be packaged in containers that look like containers usually associated with eye, ear, nasal, or oral products. Similar looking containers have resulted in people putting a topical product into the eye, ear, nose, and mouth. Over the years, hospitals have developed strategies to prevent medication errors. Some of these strategies include the following. Double check the dosing and frequency of all high alert medications. The Institute of Safe Medication Practices provides a list of high alert medications. These could be drugs that have a narrow therapeutic index, such as blood thinners. If unsure about the drug or the dose, speak to the pharmacist. If the writing is illegible, do not give the medication believing that you think you know what it is. Call the healthcare provider to confirm the drug or dose. Recheck the calculation to ensure that the patient will get the right therapeutic dose. Ask another clinician to recheck your calculations. Here's a list of more actions you can try to implement in your daily practice. Always write one prescription for each medication. Besides signing the prescription, always circle your name on the pre-printed prescription pad. Do not hesitate to check the dose and frequency if you are not sure. Always consider the fact that each medication has the potential for adverse reactions. Do not use abbreviations when writing orders. Always add the patient's age and weight to each prescription. Check for liver and renal function before ordering any medication and see if that requires any dose adjustment. Spell out the frequency and route of dosage. Do not use abbreviations. Always specify the duration of therapy. Do not say give out certain number of pills. Always be aware of high risk medications. When writing a prescription, state the condition being treated. The consumer has an important role to play. Per the US FDA, know the various risks and causes for medication errors. Find out what drug you're taking and what it is for. Rather than simply letting your doctor write a prescription for you and send you on your way, be sure to ask the name of the drug and what it's for. Find out how to take the drug and make sure you understand the directions. Ask if the medicine needs to be kept in the refrigerator. Check the container's label every time you take the drug. Double check what you're actually picking up and what you're taking. Keep drugs stored in their original containers whenever possible. Many pills look alike, so keeping them in the original containers will help to know the name of the drug and how to take them. If you're having trouble keeping multiple medications straight, speak to your doctor or pharmacist. Keep an updated list of all medications taken for health reasons, including OTCs, supplements, medicinal herbs, or other substances. Give a copy of this list to your healthcare provider. Be aware of the risk of drug-drug and drug-food interactions. If in doubt or you have questions about your medication, ask your pharmacist or other healthcare provider. Report suspected medication errors to the FDA's MedWatch reporting program. Lastly, medication errors are a systemic problem. It's very important to understand that we all play a role in preventing medication errors, be it uh, if you're someone from the healthcare system, doctor, nurse, pharmacist, or you're the consumer. For more information on medication errors, you can go to any one of the following sites for more information on uh, medication error impacts and prevention ideas. I hope you found this video educational and useful. Please remember to like and share. Thank you.